So we really push colon cancer screening, and reason for that, honestly, is it's one of the few cancers that really we've got a great screening tool for. Like,
Mhm.
really, it's probably the most successful cancer screening we have when you look at across the board. Like, even, breast cancer, we've got mammograms, but it's got its issues. It's not perfect.
Yeah.
Prostate cancer, there's really not great screening for prostate cancer. Lung
No.
cancer, you've got some CTs, but it's still very hard to
Yeah.
diagnose early. Pancreatic cancer is notoriously hard to diagnose at an early treatable stage. But colon cancer is unique in that, most colon cancers arise from these little benign polyps that start growing in your colon. And to go from a polyp to colon cancer in the average risk person typically takes a decade or more. So
Is
we've
that
got this.
something a patient would feel and know is there, or you'd have no idea unless you did a colonoscopy?
Right. Yeah. Typically, these are no symptoms at all. So,
Wow.
if you think about it, the colon is a hollow organ. You got
Hmm.
this little bump, almost looks like a mole or something that grows on the surface of the colon. That's got
Yeah.
to grow pretty large before you start getting obstruction, or even
Right.
before it starts to get ulcerated and bleed and things like that. So, a small little polyp is typically totally asymptomatic. And so that's why we recommend screening for everybody, even if you don't have any symptoms, even if you don't have a family history, because colon cancer is one of the most common cancers diagnosed today. So, between men and women, it's like the second or third most common diagnosed cancer every year. And when you look at cancer deaths, it's like the second leading cause of cancer deaths in America every year. So, but the fortunate thing
Wow.
is we've got this long window of time where we can
Hmm.
go in, find these benign polyps, remove them before they ever have a chance to grow into colon cancer, and then you never get colon cancer. So we've got this
When
long
should we
window of
start?
time to intervene.
When should we start getting screened for that? And
Yeah.
like
So,
age wise, is that kind of what
yeah.
you have a certain age?
Yeah, so it used to be everybody got screened at 50. So 50 was kind of the age when you start screening. Well, over the last decade or more, we've kind of seen this trend where we're seeing younger and younger people get diagnosed with colon cancer.
Hmm.
So